Gum recession is the lack or missing good gum tissue from around a tooth. So patients can normally experience sensitivity on the tooth, due typically to hots and colds, cold beverages, cold foods, hot foods, even as abnormal as even breathing air in can experience sensitivity that way. There's a couple things that really need to be taken into account of when we have recession. We know that recession will get worse. Also, because of recession, we do experience bone loss from around the tooth, and sensitivity can be a major issue as well. The root surface is actually softer than the enamel of the tooth, which then leads to cavities on the root as well. So what can we do to fix this? We can actually gain the tissue back. Okay, what can we do to get the gums back? There's a couple options for that. Typically in the past, we've used procedures where we take tissue from the roof of the mouth and transplant it to the area that's affected. Not a great solution. It's one that's very painful. It's very uncomfortable to the patient in terms of a pain threshold. As you can imagine, there's only so much tissue on the roof of the mouth that you can get as well. And a lot of people experience recession on multiple teeth. So what's another option for that? There's new technologies and new advancements within some of the techniques that we use that we can utilize. Alloderm is great. Alloderm is actually cadaver graft. It's graft that's been harvested that we can use. We can take it out of a package. I could use as much of it as I like. It enhances the tissue in terms of regenerating what's missing. It adds thickness to the gum tissue, so then we don't have any recession in the future. Another approach would be a non-invasive tunneling technique. What that entails is actually releasing the tissue. No suturing is involved, minimal invasiveness, less pain, easy to do, and good for the patient. Not only is recession a functional problem to where we're going to start losing bone from around the teeth, but it's also an aesthetic problem as well. And that's very easily fixed if we jump on the recession while it's minimal versus in an advanced state. So the earlier we get you in to be treated and evaluated, the easier the procedure is going to be and the more successful we'll be.